Hello and welcome to our second episode of our Voices of Public Procurement podcast. My name is Mandy Emery, the Sustainability and Social Value Specialist here at the East of England NHS Collaborative Procurement Hub. And today we're talking about climate adaptation in healthcare with Louise Elstow. So Louise is an interdisciplinary social scientist working at Cambridge University's Centre for Sustainable Development. Originally an emergency planner working with local authorities, Louise has been working in academia and as a resilience consultant, grappling with organisational resilience, climate change adaptation, and environmental resilience in a variety of settings. So this has also included healthcare, transport, and critical national infrastructure, as well as in hill farms and common land in Wales. Louise has recently been working on a project called PEACH, Project to Embed Climate Change in Healthcare, which considered climate change adaptation through healthcare investment and procurement. Welcome, Louise. If you want to take a minute just to add to that introduction, it'd be great.
Hi, thank you very much for having me on the podcast. I'm really delighted to be here and to be talking to you a little bit more about the PEACH project and the implications that has for procurement specialists in healthcare.
Brilliant, thank you. So if we did a little too long, didn't listen, if someone was to take away one thing from this conversation, what should it be?
I think it would really focus in on thinking about all kinds of procurement as having the potential for contributing towards adaptation. So climate positive adaptation involves or should involve everybody from the NHS, and understanding that any NHS member of staff can support a more adaptive approach to the use of NHS resources. So this is really important now because climate change impacts are already locked in. So mitigation is really important, limiting the likely impacts, but there are some that we can't avoid doing because of what the choices we've taken already.
Yeah.
But also at the moment, there's a lot of change going on in the NHS, and with that great frustration and change, there's also a lot of opportunity potential for people to do things differently. So I suppose I'm trying to take a positive spin on some of the disruption that you might be facing, and just saying that offers a really great opportunity to start designing in thinking differently from the start and taking into account adaptation from as early on as possible.
Absolutely. And I think it's a topic a lot of us still aren't quite comfortable yet. So it's very important to have these conversations and figure out how to actually embed it, in early decision making.
Absolutely.
So I understand one of your most successful projects has been the PEACH project. Could you tell us a bit more about that?
Yes, so as you mentioned in your introduction, it stands for the Project to Embed Adaptation to Climate Change in Healthcare. So it builds on some research that I was part of. It was a European research project that was looking at climate adaptation, particularly in healthcare settings. And I took some of the outcomes and findings from that previous piece of research and was looking at how I could apply that in an NHS setting. Because although we were part of this European project, there was no NHS partner involvement in the project as one of our pilot studies. One of the key things that we developed was a set of 12 principles that anybody can adopt to incorporate a more adaptation positive stance. So that is throughout the entire procurement and investment process. So we weren't trying to introduce a new process. Everybody's already got procurement processes in place already. But what we wanted to do is to think about how that whole process could become more adaptation sensitive. And in doing so, we also developed a resource kit called HARK, so the Healthcare Adaptation Resource Kit, that provided a number of interventions that people could think through, a number of risks that they could apply to their particular settings, and then also a way of trying to use those resources to do better thinking around what adaptation looks like in that setting.
Fantastic. So, Louise, your work on the PEACH project highlights the complexity of climate adaptation in healthcare. How can procurement teams simplify first steps towards adaptation positive practices?
So I think one of the really key first steps that you need to be thinking about is making sure that you have a sustainable procurement policy in place. So one thing that it really needs to incorporate is not just sustainable procurement, but sustainable procurement that specifically speaks to being adaptation positive. So often you might think about environmental aspects, about wider issues on sustainability, but really making sure that that policy really gives everybody clarity about what the direction is that they should take and how they can start supporting that within their role. So that for me is one of the really key steps. And I think tying that in with a really good understanding of the risks that your sites and facilities and organisations face, that's where everything really needs to begin. So you know what the direction is of travel or where you're trying to get to, and you have a really good understanding of what the kinds of risks are that are likely to affect you.
So it really does come back to that early involvement and early understanding of what your risks are.
100%.
Thank you. So when you spoke to the members of our Sustainable Procurement Forum, you described the differences between mitigation and adaptation thinking. How can procurement professionals recognize and act on adaptation opportunities within everyday processes?
So adaptation thinking is really about thinking about a future and making procurement decisions today that are sort of future proofed, that have that long-term future orientation built into them. So in my presentation, and I've just mentioned it just now, I described the 12 principles for adaptation positive procurement. And one way of weaving these into everyday procurement processes is to think about which principles are more doable in your role. So there were 12 procurement principles, and some of those might be more appropriate for decision makers who are setting policy. Some of them might be more appropriate for people who are understanding risks, and some of them might be more appropriate specifically for procurement professionals who are working with end suppliers. So it will be taking forward, really having a think about which of those principles is appropriate for your role, and where you can start to leverage those things.
Okay, so that comes back to your earlier point as well. But with talking about those principles, which of these principles do you think would be most practical for NHS organisations to adopt first, and why?
Yeah, so I think linked back to my earlier response around making sure that you've got your sustainable procurement policy in place, and then linking that to risks. I think that grounding, and I know I just touched on that before, but I think really having a location and site-specific understanding of the risks. That's not a generic, we know it's going to get hotter and flood more, but I really understand how it's going to, where it's going to flood, what services are going to be impacted, where things are going to overheat, where equipment's going to fail, and really understanding those thresholds, understanding who or what is going to be vulnerable or exposed to those particular hazards, and how that's going to impact on service delivery. So that grounding in risk is really, really important. Otherwise, we end up in very generic statements, and that doesn't necessarily help us make better quality decisions, because you could then end up trying to procure in a way that supports a risk that's less concerning than another kind of risk that would have a greater impact that we really don't want to, that we really want to avoid.
Yeah,
so it helps us have better
absolutely.
quality decisions if we understand what the risks are that we're going to face and exactly where and how it's going to impact on us.
Fantastic. Well, thank you for setting that so clearly out for us. You mentioned earlier the tools and the resources that were developed as part of the PREACH project. So how do these tools support procurement teams in making better long-term investment decisions?
So the resource kit that I mentioned is a really helpful place to start if you kind of don't know where you're going on that journey. It provides a range of different adaptation options, so interventions that you can take, particularly towards the physical impacts of climate change. And your first step would be to think about which of those options might be suitable for your situation. But if you, for example, are at risk of flooding, you might have a range of interventions on that big long list that might be suitable, but you obviously don't have an infinite budget and an infinite time to put those into place. So it can be really helpful then to start to use the principles to reduce your risk and your number of options down. So it's not about doing all of them or trying to squeeze them all in. So you can start to tie that in perhaps with an idea of an ideal investment period that you might have within which to make your appropriate interventions. So you would then start to focus in on the potential options that would be the most effective for the kinds of risks that you have, and then also the order in which you do them. So some of the interventions might be quite large and quite significant and impact on service delivery whilst you're making those changes. And those things might have planning applications to go through. You might need to source a significant amount of funding for them. So in the intervening time, you could take smaller interventions, but they might not be as effective in the long run. So these long-term investment decisions, we really do have to think about putting a pathway towards adaptation in place so that we can make sensible decisions, but we can build in the lead time that they take. And taking this kind of systems approach where we're looking holistically at the risks across the site really can start to help support that long-term decision making and making sure that we're not spending money on little ad hoc changes that won't really make very much change in the long run, but are also really setting us up for the fact that we might have to do this over a staged approach in a particular order to get to where we want to be.
Absolutely. So starting small is better than not starting, but we really do need to keep the bigger picture in mind.
Exactly. Otherwise, we could sort of just be chipping away. And some of these things, we actually need to make quite fundamental changes to the things that we're doing, and doing sort of small piecemeal things and taking decisions just on the which is cheapest option tends to work in a short term, but really won't necessarily help us in the long term.
Absolutely. So based on your work across sectors, that was including transport, utilities and healthcare, what common barriers do you see when embedding climate resilience into procurement?
So I suppose one of my first things I would say is that it's not just the role of a procurement specialist. So procuring for climate change really is just sort of one piece of the puzzle. It's not a standalone activity, so it needs to be built into everything that we're thinking about. So we need, if we're designing hospitals and facilities and products that are climate resilient, we need people who are designing them, engineers and architects and product designers, to design climate resilience into those products. We need them to be available in the market. And we need to have suppliers who are able to supply those things at the scale that we need them to do. We also need funders and financiers and insurance people to fund and finance and insure the things that we're doing, particularly if we're using novel building materials. There might be reticence to do that if they're untested or relatively new and uncertain. So there's all of these different people who need to be doing their piece of the puzzle at the same time as procurement specialists.
Yes.
So embedding climate resilience into procurement is also about embedding it into the wider landscape of the way that things get done. Because otherwise we end up, somebody buys something, it gets put somewhere and people don't use it in the right place. It doesn't respond to the right risks. It doesn't necessarily do what we want it to do. So that and linked into a big barrier being, as I mentioned before, around this sort of short-termist thinking and how we value interventions. If we only value them based on how much they're going to cost and to procure and install and maintain for a year, we would always choose the cheapest option. But if we start to think about things in terms of the future costs of maintaining them or replacing them, and what happens if we don't have a supply chain anymore? What happens if that supplier is out of business? What happens if that material is no longer fit for purpose or we're not allowed to use it? What happens if actually we do have a flood and those sort of smaller, cheaper interventions that we took don't actually make very much change? Then actually we need to start to take into account those long-term costs and the costs that we avoid into account. Then we can start making better quality decisions. But it can be really difficult to change that mindset of just, we've got really small budgets now. We've got short procurement windows for doing things now. I have to make these decisions quickly. So it is really difficult. I'm not saying any of this is easy.
Yeah, absolutely. It's just everyone sort of seeing that sustainability is everyone's business. We all have to play our
Exactly.
part.
Yeah,
Thank
definitely.
you. So how do networks like the Sustainable Procurement Forum play a stronger role in building shared capability and confidence among the procurement professionals, or indeed anybody who might touch sustainability or climate adaptation?
So I worked on a project that was looking at building climate smart buildings. So how do we get more of them built? And by climate smart, I'm talking about buildings that is designed to be adaptive and also low energy, low carbon. And actually, one of the things we looked at was around these barriers, and they were particularly highlighting, because we had a range of people from the insurance industry, from funders, financiers, architects and builders, and the construction industry. And they were really, really key to sharing case studies about what's been tried and tested, what's worked, what hasn't worked, and understanding why. Because we found that often people would say, "Oh, this didn't work," and we don't want the sort of the story from that to be this product never works in any situation, but really understanding why a product or a solution did or didn't work helps you understand, A, to avoid it if you've got a similar situation, but also to start to go, oh, okay, well, actually, that's not the case for us, and actually that might work for us. And really being able to go to somebody to explore how to embed these things into procurement practices. So I think specifically for procurement professionals, the Sustainable Procurement Forum can play a really strong role in providing templates, sharing case studies, working documents and things like that, where climate resilience considerations are inbuilt. If we can get climate resilience considerations built into the sort of technical tools that we use, checklists and things like that,
Yeah,
that's where people start to ask the right questions. We start to normalize these things in conversation. It's not just because, I don't know, Jill, the climate sustainability lead, is the annoying person who's always asking that in the meeting. But actually, it's just what everybody does in the meeting. You don't have to rely on a particular person. And I think particularly in the environment at the moment where there might be a lot of staff changeover, if we can embed these things into processes that are in systems and procurement systems, then they are less liable to fall apart when somebody leaves the organisation or if they move on to a different post.
absolutely. And I guess that shared learning kind of limits that as well, then, because others can take on that knowledge as well.
Exactly, yeah.
Yeah, perfect. Thank you. So I do just have one more question for you.
Mhm.
So if listeners were to make one practical change today to support adaptation positive procurement, what would you advise they do?
So I think, again, touching on what I've probably said before a couple of times, I think really getting to know your organisation's climate risks and impacts, really understanding how they're going to affect your site, your particular sites, your particular services that you offer, and the particular demographics that they serve, though, will also be differently affected depending on who you're looking after in those sites. And then also thinking about what adaptation positive procurement needs to look like in your specific organisation. So you will sit in a particular organisational structure and a particular policy landscape that's defined partly by NHS, but also partly by some local decision making and the way that you do things. So I would really invite people to look at the physical landscape that is around them, look at the sort of policy and procurement landscape and what is already guiding them towards adaptation procurement, adaptation positive procurement. And then I'd also just have a walk around your site with your emergency planners, with your risk professionals, with your estates and facilities managers, and really start to think about, okay, what does adaptation procurement need to look like in my organization? Like, what can I actually start to envisage that looking like as changes to the physical infrastructure, as changes to how we do things in our organization?
Fantastic. Well, Louise, thank you so much for taking the time to attend our session. That has been incredibly informative and really do appreciate you explaining that so clearly for us and our listeners.
You're
Um,
really welcome.